Welcome to How Do We Push for a Healthy North Carolina. We're so glad to have so many folks in the audience. We'll give everybody a chance to log in. It's really amazing to see so many people interested in advocating for a healthy North Carolina. You're going to hear from some amazing advocates tonight and have the chance to talk to them, and hopefully we'll be able to give you some directions on what we're going to be advocating, what you can be advocating for. My name is Graig Meyer. I am the Executive Director for the North Carolina Justice Center, and I'm proud to be hosting this evening's event, which is sponsored by Beacon Media, North Carolina's pro-democracy nonprofit news organization, sponsored by Carolina Forward, and it's sponsored by Resource Rural. And we're going to be making the online debut of a fantastic 10-minute brand new documentary about the Healthy Opportunities pilot project. And we have some amazing panelists here today to talk to you about it. We have Kody Kinsley, the former Secretary of the Department of Health and Human Services, who oversaw the HOP project. We have Preston Blakey, the mayor of Fletcher, North Carolina, which is you're going to see the documentary set in Western North Carolina, where Preston is mayor. Preston is the second youngest mayor in the state of North Carolina, and he hosts a podcast, but he co-hosts a podcast for Beacon Media called Do You Even Live Here with Dalton George. He's the second youngest mayor in North Carolina. He's the mayor of Boone. And we have Deborah Ogiste, who was a HOP program recipient. Talk about the difference that it made in her life and the life of her family. Once I've watched it, and we'll have a little conversation with the panel that I'll facilitate, and then we'll open it up for questions. There is a Q&A button at the bottom of the Zoom screen for you tonight if you're watching, and so you can submit questions there that you would like to have our panelists discuss. We would love to hear your questions before when we get there. Feel free to start submitting them now. Unless Jeremy tells me there's anything else that I need to tell people before we launch, I think we want to get started with the documentary. We're really appreciative of Resource Rural for funding the work on this documentary. We are going to watch it for about 10 minutes, and then we will have a chance to discuss it with the panelists and then get to your questions, which again, you can put in the Q&A.
I've lived in Hendersonville for about 20 years. I was just driving here and I saw the mountains, and it was the first time that I fell in love with something that wasn't a person. I get to work with an organization called Caja Solidaria. Our mission is to ensure that everybody has access to the abundancia of our beautiful southern mountains. We started as a produce buying club during the pandemic because there's a shortage of food in our grocery stores. I was volunteering at Caja when we heard about the Healthy Opportunities pilot.
Healthy Opportunities is one of the most innovative ways that we can spend healthcare dollars. So the goal wasn't necessarily to just reduce spending. It was to spend the dollars better. In North Carolina, our General Assembly was really trying to understand how we could reduce the cost of the Medicaid spend and get better health outcomes. In order to access the program, an individual had to have access to Medicaid managed care. Adults had to have at least 2 chronic conditions that could be improved with access to services, and children had to have at least 1. Most of your health outcomes are decided before you ever get to see a doctor. What people are eating, whether they have a safe place to lay their head, if they have transportation to get to the things they need, that's how we define health in North Carolina.
I'm a single mother. When we heard about the Healthy Opportunities pilot, I was living in public housing. We were on Medicaid. My son was having gastrointestinal issues. I took him to the doctor and he was prescribed a prescription food box. Back here is our food is medicine grocery shopping. All of it is organic. All of it is as local and seasonal as possible. And I'm going to take what I think my family is going to eat for the week. When the Healthy Opportunities pilot was in service, people got to come grocery shopping here for free, and they'd be able to take 1 or more baskets home with them. When we received the boxes, my son did not need medicine to alleviate his symptoms. It was very empowering for me personally because it made me feel like I can provide for my family. Being employed at CAHA, we are no longer on Medicaid. I bought a house by myself. It was the Healthy Opportunities Pilot and CAHA that has allowed this to happen for my family. At the time of the Healthy Opportunities launch, we started with like 45 participants, and then within 2 years, we got up to serving 450 families. Within our last year of operations, we were able to invest $2.5 million within our local economy. And that was through supporting local farmers, local businesses.
It was a family-owned farm since the late 1800s. In 2022, we started cleaning up the property with the intention of becoming regenerative and organic farmers. One day we met the ladies from Caja Solidaria. We were growing as much as we can, providing as much eggs as we could, and they were buying every product that we could produce. It encouraged me to go lease another farm.
Over 400 farms were involved in selling into this program. We've seen over 900 jobs created.
Thank you so much.
You're welcome. It's my pleasure.
We cultivated intentional relationships and connections with people in the community. I am saying, hello, how is it going? Let's see what resources we have to try to get your needs met.
Housing has a huge impact on health. Stabilizing housing is a really important part of how Healthy Opportunities works.
We had mold in the house, and my grandson had autoimmune things and lung issues. We were both sick all the time. I remember calling someone and saying, listen, I have mold in my house. Is there anything y'all could do about it? They said, well, HOP will take care of it. We have funds that can help you. The mold was so bad on this side of the house, they had to gut the bathroom and start all over. It was in the walls, it was in the floor. That network was developed from HOP. Some of the people I don't even know, but they all stepped up and just took care of it.
It's really about meeting a person as a whole person, not as a diagnosis, not as a social need. We want to make sure that our clinical spend is focused on what it needs to be, not what could have been prevented if we invested earlier and in better ways. We were optimistic that we would see some positive movement in that first 18 months, but we were blown away by what we really saw. Huge drops in emergency room visits and in hospitalizations. Initially, the spend goes up, but they showed the cost curve bends down. And ultimately, you could see a cost savings about $1,000 per member per year. So to see this, it's a huge potential for us to really shift the way that healthcare dollars are spent in the country. We were notified we would have to stop services by the end of June. So our initial heartache was for our families that were losing access to services with very little notice.
The Healthy Opportunities Pilot was meeting people's basic needs, the needs that we have in order to not even thrive, but just to survive. We had to lay off 7 staff members. It's a really big loss to the community. It's the farmers and the organizations, like there are so many people involved in making the Healthy Opportunities Pilot happen.
Unfortunately, when we heard that the Healthy Opportunities Program was going to end, I had to put the brakes on. Now I have to have our workers work less hours. We've had to lay 2 people off. How do small farmers continue to exist when it's such a challenge to be profitable?
Healthy Opportunities gives us the greatest chance of making sure that folks are fully supported until they can get to that next step. It's a hand up, not a hand out. This program shows how much we care about each other, and that's a really important part of a thriving community. Not just that individuals have what they need, but they live in a community that sees each other and is committed to caring for and lifting each other up. Investing in these other drivers of health can get us to a better place.
Thanks again to Beacon Media and Carolina Forward and Resource Rural for the collaboration on putting together this documentary about HOP. Now, you're likely here because you know the story about HOP. You likely know its success, and you likely know that it has disappeared because the General Assembly has failed to fund it as an ongoing operation. Even seeing this, knowing the statistics that you saw on the screen about the impacts that it makes on people's lives and how much money it saves the state on healthcare costs. HOP really revealed to North Carolina something that's possible, and then unfortunately was taken away, and shows how sometimes things that are possible and good can be removed. I want to ask each of the panelists who are here tonight to introduce themselves and to say whatever you want about yourself, but please also tell us, what do you think that HOP as a program showed us of what North Carolina is capable of? What, if we did this again, we did it on an ongoing basis, what could it tell us, and what could it help us do to make North Carolina the place where we really want to be? Kody, you administered this program as Secretary of Health and Human Services. Let's start with you. And what do you think?
Well, thanks, Greg, so much. It's really wonderful to be here with everyone. Let's start here. HOP was really the standard bearer for the nation. North Carolina was the first state to conceive of this idea, which is how do we take dollars that we are holding on to until people get sick and actually use those dollars before they get sick to keep them healthy. And I'll just be frank, like, I was surprised when 2 years in, the program was as amazingly successful as it was. And states all across the country started copying North Carolina, looking to North Carolina for experience on how to do this and how to do this well. And that's not to say that there weren't lessons learned. I think we learned a lot. It was always designed to be a pilot. And Lori talked about some of that in the documentary around how do we get more people signed up faster? How do we try to get folks going? And I see the promise of this program as really answering a question that I know the General Assembly is wrestling with now, which is how do we control Medicaid costs? And how do we control healthcare costs broadly? This is an issue that the entire nation is wrestling with. And so if we were to go back to the tenets of HOP and to really double down, but not turn away, double down, expand access, make the program statewide, we would really be able to help curb costs by keeping people healthy and keeping them away from needing the high cost care that you end up getting in the hospital when you get sick.
Let's take it over to Deborah. As a program recipient, tell us, if you want to introduce yourself in any way, please do, but please tell us what you think it shows that we're capable of in North Carolina.
Well, I came into as a volunteer of the Henderson County Committee for Activity and Nutrition. And my grandson was having, as it says in the film, he was having a lot of autoimmune problems. And when it was introduced to me that this might be a solution to get him to health, you know, it was wonderful. And as what it says about North Carolina, Western North Carolina is what I can speak on, is it showed community. It showed a coming together for the health and healing of communities. Of course, it took everything into consideration. It took isolation of our elders. It took into consideration the well-being of our children. And personally, my grandson was in the hospital at least 4 times a year for 3 to 10 days at a time. Now, he hasn't been in the hospital this year at all. And I'm right now sitting in the car at a soccer game, and he's playing soccer. And there was a time when I'd have to be out there with his asthma pump, waiting for him to have an attack, and I have to run out on the field. And this all happened not just as a result of HOP program, but the way the HOP program and Impact Health brought the community together to heal.
I love the image of him running out on the soccer field, and just the idea that he's out there right now is great. Preston, this documentary was filmed in your community, Henderson County. What was the impact that you saw as a mayor, and what do you think it shows is possible for North Carolina?
Wow. First and foremost, I'm really grateful to be here with you all, Greg. We're friends. Just got to interview Greg this weekend. You're all a wonderful person and a big loss in the General Assembly, but I know he's on to greater things in his new role. Secretary Kinsley, last time he and I saw each other was under much worse circumstances. It was Hurricane Helene, and we were with then former Governor Cooper, and we were reviewing our park and trying to figure out how to get things fixed. And Ms. Deborah, we spoke just a couple of hours ago and we talked about your young son, and you said we had met before, and you said that I guess he and I had been hanging out when we had seen each other. And so it just brings me so much joy to hear that he went from being in the hospital a couple times a year to quite literally him playing soccer right behind us. I mean, that is a testimony to how well this program works in and of itself, truly. And I'm glad to see it happening in Henderson County, my home county. Nevertheless, the Healthy Opportunities Pilot, I think it really showed when North Carolina can lead, we can decide to treat healthcare as more than just what happens at the doctor's office. And I think it's something really powerful because HOP recognized something that we recognize at the local level quite frequently. I mean, we're consistently talking about housing, we're talking about food, we're talking about transportation. And these things are all deeply connected to the outcomes that our residents experience in their livelihoods. And not only did we recognize that and the HOP recognized that, but I think a system was really built, right, to support those that are most in need, that are most vulnerable in our communities. And it measured the results, and the results showed that it worked. And to be frank, I don't think that's easy to do. It's not something every state has figured out. Secretary Kinsley just mentioned that states are copying North Carolina. It showed that we're capable of being innovative, right? We can be collaborative. We can be focused on outcomes, just not services. And I think the opportunity is really whether we build on that with something that's working or let it fall away. And so I think we're at this really critical juncture where, people come to me and other local government leaders all the time. They're asking for solutions. They're asking for help. We do food drives every year for Thanksgiving. We give it to our food pantry here in Fletcher, and we see that those folk lined up every weekend, and it's heartbreaking. But we have a real solution now to get to some of those underlying impacts of health. And so it shows that North Carolina is capable of something that's incredibly intuitive, that really helps and supports vulnerable populations in our great state.
Have any of you been able to see, now that the program is gone, have you been able to see what has happened in the communities since then? Like we heard about the farmer who lost a source of income. We heard about some jobs that were lost. What have you seen that's been the impact since it's disappeared?
Well, through the Committee for Activity and Nutrition, I created an organization of grandparents raising grandchildren. Through that organization, many of them were introduced to the HOP program because a lot of the grandchildren are born with divergence, COPD, lung problems, PhD, dyslexia. And some of these things are corrected through diet and others through just the holistic community coming together to pay attention. Also, grandparents are nervous and tired and trying very hard to fill the gaps that need to be filled. Now, I'm saying that to say this. Illness is a holistic situation, and HOP covered it all. Because if I had one grandparent that car broke down, they did not have the funds to fix the car. As a result, she was starting to suffer from migraines. The kids weren't getting to school. So the family unit started breaking down. Through the HOP program and Impact Health, they were able to come in, repair her car, and bring a semblance of wholeness back into the family unit. Now, I'm saying that without the HOP programs, I am seeing whereas some of these things gave people pride, made them feel better about their lives, took them out of fear of failure, knowing that they had a community and people that they could depend on when things got scary and hard. to going back into fear. Going back, and that fear transmutes down to the children and the way that they conduct themselves in an educational environment. So what I'm seeing is things gradually going back to square one, where family units that are struggling are not feeling safe in their communities anymore.
It's amazing the way that you talk about this public policy program, which would get measured based on dollars and outcomes, as really about dignity and the way that people feel their family is respected, safe. The words that you use are just like basic dignity words. And not all policy gets to that level.
No,
Kody Preston, is there anything you wanted to add on this point?
I'll just add that I am so moved to hear both the responses so far. And I think about it, Preston mentioned where we first met together in Fletcher after Hurricane Helene. And I remember at the Emergency Operations Center when we were working and Governor Cooper was working every single day going up to Western North Carolina to try to make sure that needs were met and we were responding to this horrific storm. The fact that HOP had already been in place and the fact that it had already built a network of social care providers, people who had access to food boxes, who knew local community members, who had trust, we were able to leverage HOP in that response as well. And I think about now moving forward when we have future storms, not having that infrastructure on the ground is a loss for our communities and a loss that we should be really concerned about. And that's also what I'm worried about.
Especially coming out of Hurricane Helene. We're dealing with challenges that I think don't just exist in isolation. I think I heard Deborah use that word isolation earlier too. I mean, families that just aren't struggling with one singular item. It's food access, it's housing instability, it's transportation. And sometimes it's all of those things at once. And the hurricane really exacerbated that in Western North Carolina. So when those storms do happen, and God forbid it happen again, I hope it doesn't, but it exacerbates these issues. And we're better when we have these programs in place that are on the ground, right? And traditionally, I think we're asking people to navigate multiple systems and we're trying to piece together this support. And that can be really overwhelming for families, for individuals. I think what HOP did was really simplify that and it met people where they actually were. When I'm watching that documentary, those are organizations and individuals that I personally know and have interacted with in my day-to-day work as a mayor. From a local government perspective, that matters because when those needs go unmet, it shows up everywhere. And to y'all's point already, it's in our schools, it's in our workforces, it's in our public safety systems. And programs like HOP, it just doesn't help individuals. It really strengthens our entire community. And I think that's really evident by the documentary in Henderson County, my home county.
We have a comment in the chat from Melissa, who works at Thrive in Henderson County, and she said their organization works with about 100 participants, and since the program ended, their 4 case managers are filling the gaps by picking up food for a majority of the participants. They're supposed to be providing housing stabilization because the HOP program and food scripts have ended. They have so many more people who have food insecurity again. It's a situation where a nonprofit organization just can't fill the gap at the level that a state-funded program can, which leads us to, there's a lot of overlapping questions here about kind of what was the documentation of how much impact there was. And then with that documentation in place, why would the General Assembly refuse to continue the program? I have an answer to this, but before I answer it, I'll ask Kody if he has an answer to that. What was the documentation? What was the proof of the concept that you saw as secretary? And why do you think that we were able to extend the program even when we had such good evidence?
Well, I can answer the first part of the question really well, which is, we had an independent evaluator at UNC. A lot of other evaluators actually at Duke and others across the country looked at this program and saw that, as Lori said in the documentary, it was bending the cost curve to the amount of $85 per member per month. I'm here to give you a hot take, which is that I know that there's been further analysis done, and that number is actually going to be even larger. That the value out of this program, once we had more time and more involvement from people, that it really drives down costs quite markedly, like kind of 3 times that number, even when you account for the administrative costs. So it's really powerful. I think that the General Assembly got a little wrapped up in the cost to stand up the program. And it seems like they also got a little wrapped up in no budgets passing at all. And so I really defer to your expertise.
You're being too polite, Kody, but maybe that's because you're trying to advocate for it. I'm going to ask you one more question before I let you off the hook, and I'll tell you my opinion based on my expertise. But I know you continue to work in the health space, and I know you stay in touch with some of the key healthcare legislators. Do you think the door is still open? Like, has it been persuasive enough that it could come back on the table if the conditions are right in the General Assembly?
I hope so. And let me tell you this, I do a lot of work nationally, and I just had a conversation with a senior federal official who works at the Center for Medicaid and Medicare, and they're supportive of this program. Like the authority that we have to do this program is still in place because the federal government, this program was initially conceived of and approved by the Trump administration in President Trump's first term. SEMA Verma signed off on it then. It was incepted in North Carolina. We came up with the idea, but they said yes. And they're still saying yes because they also see the value in it. And so I'm hopeful that with this new analysis and with maybe a new chance for some legislating here in Raleigh where folks are coming back together, that we won't leave this opportunity on the table because of the lives that it's changed. And frankly, because we have got to get healthcare costs under control. And this is a surefire way to do it across the state. I'm hoping we'll see it come out of the department soon. I know that it's been on schedule for a while.
So it'll come straight from the Department of Health and Human Services.
It'll come from UNC because the UNC did the analysis independently. But we always were going to do an interim analysis that came out, and we've been on schedule for the final analysis to come out soon.
And are there other states that are doing a HOP model and where we're seeing its ongoing effectiveness?
Absolutely. I mean, investing in food, it all looks a little bit differently. Some people do it through community care hubs like us. Some people do it in a statewide model. Some people have done all food. Some people have done all transportation. But pretty much, I think it's like 35 states have done some version of this now as inspired by us.
It's like such an old story for North Carolina to be the beacon of the South, the beacon of the country, to stand something up and do it, and then watch other states learn from what we do and then take it away from our own people. It's very sad. I will say, in my previous role as a state legislator, I think when I was still in office, there were lots of talks about how to extend HOP. There is support across party lines. As Kody said, there was a challenge with the fact that we don't have a budget, and so there are certain things that are just not getting funded. Could HOP be funded in a budget agreement this year? I do think it could, because I do think that you have the right set of incentives, that it doesn't have to be something that is a highly politicized thing, right? It keeps costs down, it employs people who we want to employ, including the farmer angle, and it provides direct benefit to people in the community. All things that are generally considered to be positive across party lines in the General Assembly. And so there needs to be ongoing and continued advocacy. And I wonder if people in the Q&A, if you have ideas of advocacy, go ahead and put those in there. What is your organization doing? What would you like to see organizations do to speak up and advocate? And I will say that at the North Carolina Justice Center, where I'm executive director now, our health access program has been advocating for continued HOP funding, and we will continue to be. And it's one way that people can be engaged, is to connect with the North Carolina Justice Center, and we can support you and your engagement in that. Preston, Deborah, are there ways that you've been engaged with advocacy, or things that you've done that you think other people could do to try to advocate for more HOP funding?
Yeah, I think for me, I've really been trying to communicate effectively with the organizations that have been incredibly impacted by HOP, who are providing this service, and see what their experience is and talk to my legislators about it. And so I think that's really grounding, right? And I wanted to be sure to tell the story today about an organization moved to Fletcher while the pilot was in place. It's called the Asheville Buncombe Institute of Parity Achievement, but coincidentally, it was in Henderson County in Fletcher. And they were serving about 1,000 households across Buncombe, Henderson, and Rutherford County through HOP. And so they were doing food distribution with home delivery, community health workers, and they're really helping people manage some of those conditions where they were incredibly impacted by diabetes, hypertension, high cholesterol. And when the funding stopped, those services, of course, stopped immediately. And interestingly enough, you all just talking about data, BIPA, let's say use that for short, they did some research of their own, and I asked Joanna Greer, who's the executive director today, to share some of that data with me. And what they were able to find out with some of the research they did, that nearly 80% of participants said their ability to have enough food worsened after HOP was ended. And more than 80% said their ability to maintain a healthy diet declined. And then even after 6 months, 90% of the participants reported that their food often didn't last long enough and they didn't have the money to get more food. And then there's a similar percentage that said they couldn't afford just healthy, high quality, balanced meals. And so that's a real impact in our communities. And I think what is just as important, I think this was highlighted, was just not those impacts to those families, but the folk that worked for ABIPA in that organization. And so they were supporting 24 volunteers who they no longer need. They don't have those volunteers anymore. They had 8 full-time staff and they've been cut down to 4 full-time staff members. And I think from a local government perspective, that capacity always matters, right? And so when we see organizations like ABIPA really scale back, they were showing up in our schools, they were showing up for our public safety officials, all these organizations, right? And so I think it's really important to continue to tell those stories like ABIPA, right? And tell the stories that were in our documentary, because those are real life, tangible stories and impacts that people can understand, and there's data to support it. And so I will argue for folk, continue to tell the stories, tell those stories to your legislators, tell it to the governor, tell it to the people that represent you, because again, we can see the community impact.
We got a question in the chat. If you have access to the ABIPA data, could you answer the question in the chat where somebody asked about it so you can share that data? And we had a great resource from Lori with the impacthealth.org/hopworks to get a lot of educational resources there. Deborah, do you have advice for people? What do you think people should do to lift up their voices and fight for this?
What I've been doing is just start telling the story. One of the things that came out of the session that we had in Raleigh last week was that the story hadn't been told. So even though people got the data and they were looking at the numbers, it didn't hit home with the personal stories. So every time I get a chance, I talk about what HOP has done, what HOP can do, what HOP will do, because it's amazing the people I run into that had no idea.
Well, then you're a great storyteller.
Thank you.
You get a lot of credit in the comments. People loved hearing from you. Kody, there's a couple questions here about thinking about other allies. Are there ways that we could get healthcare providers involved in supporting HOP or prepaid health plans? What can you say about some of the business side of the health industry and whether or not they would be supportive here and how we could leverage their strength?
Yeah, absolutely. I think one is, and it's been mentioned, and this is maybe specific to the HOP participants, but this is a job creating program. This is great for local communities, great for the tax base, from a chamber's perspective for support there. On the healthcare kind of industry side, I think about the power of this program as being the tool that a lot of our healthcare providers have always wanted. They've often felt like, they know that you just need access to food. They know that you need access to safe housing. And they've been doing for a long time something that I call pamphlet and pray. They give you a pamphlet and they hope that it turns into something. And now with the HOP program, they can actually kind of refer you for care through our closed referral network, and they can actually see the full loop of when it's fulfilled. Now, there's some kinks there, it's got to get worked out. It's a pilot, but for a provider to be able to see them being able to give their patients the thing that they know makes a difference, then that's a real win for them from improving the morale in the work that they're doing in a field that we know where a lot of our, especially our primary care physicians, are getting really burned out. And then last but not least, we already talked about the economics here. This is saving a lot of money in the Medicaid program. And so there's a benefit to our managed care companies being able to put tools like this into place. And I think the opportunity to really double down on those services that make the biggest difference and to take it statewide could be really valuable to our managed care plans as well. It's something that they should be proud of. Managed care, we can't do these sorts of programs without the 1115 waiver. Sorry, that's a little nerdy talk, but essentially the tool that allows managed care to exist. So I think this is like a gold star that, that managed care companies can take pride in, something that they made possible and that they're a part of in making this work, and with all the other partners like our HOP operators. And so I think another key partner in getting this to the finish line of getting it reinstated.
Kody, there's a question from Rebecca Wilden, the executive director of Carolina Forward, that says there were 3 regions for HOP, and were there differences in those regions and how they were set up? Are there anything we learned from them that we should be advocating for in the next version?
Yeah, so really we set out in these 3 regions, the West, the Northeast, and the Northwest. West, north, south, southeast, northeast. And because we wanted to, frankly, at the time, this was pre-expansion, we wanted to really test, how could this program work in some of our areas where we had a legacy of people being uninsured and we had a large amount of chronic disease, some of our sickest folks. And the belief was is if we can make a positive difference where it's hard to reach people, where they have a lot of chronic disease, if this works there, then by gosh, it will really work where we have more densely populated places with more access to the healthcare system. And so another reason to go statewide, we intentionally tried to do it where it was really hard first, and we learned a lot. There's different communities, very different structures and access, different partners, and so we tested a number of the aspects of.
Preston, you're going to be doing an episode of your podcast on HOP coming up. Will you give us a little plug for the podcast and tell people what to expect if they want to learn more or use the podcast as an advocacy tool?
Yeah, sure. Again, just to give a shout out to my co-host Dalton George is the Mayor of Boone, the second youngest mayor in the state, and I'm now an old mayor at 31 years old. Dalton's 26. We host a podcast called "Do You Live and Live Here," where we try to raise up the stories of North Carolina that often get overlooked. A Healthy Opportunities Pilot is one of the stories that we want to highlight. And so we hope to bring a lot of relevant data related to HOP, advocacy work. I must have an interview on there that's a real life example of somebody that was impacted by HOP on the organizational level. And so that'll be releasing pretty soon here. And you can find us on Spotify and Apple Podcasts. And please tune in. I think it'll be a great advocacy tool. We'll have a lot of good information there.
And Jeremy Borden from Beacon Media says that a recording of today's session will be available soon. So if you're registered, we can make sure you get an email of that. And the documentary itself will be available as well. You got to see it here first because we were doing some screenings of it before we sent it out. But these are all tools, the podcast, the documentary, today's session, that you can use to organize and mobilize folks. And that's what it takes, really to get things done in the General Assembly when they're not something that isn't a highly politicized thing. And this isn't. This is something that a lot of people agree on. It just takes having enough folks from all corners of the state to raise it up as an important priority that we should be including in the state's budget. Hopefully, we'll have a budget by June 30th. And so the time is now for folks to be raising the importance of this and trying to get it up and going again. I want to hear if anybody has closing comments, any further reflections on the program that you think people should know about, or any advice you want to give them. Let's see, Deborah, let's start with you. What closing comments do you have?
What? Let me think here. One of the things that I would say is it's important that we shift the narrative from healthy eating, healthy life to quality of life. And I think that's the American dream. That's why people migrated here. That's what they came to America for, a quality of life that was not available where they were. So I think it's important that we recognize and realize that America is about having a quality of life. And when people cannot feed their families, when people cannot work because of other extenuating circumstances, when we are not taking care of each other as a holistic community, we are not providing a quality of life that is just the basics. And so, if nothing else, just think, let's holistically work together so each American can have a quality of life that sustains the family to be successful.
Life, liberty, and the pursuit of happiness, right?
That's it.
Deborah Ogiste, running for the General Assembly soon on the Quality of Life platform. Preston, what closing comments do you have for folks?
First and foremost, grateful for you all being here, listening to us, being engaged, asking good questions. Grateful for my co-panelists and Graig Meyer, Beacon Media, Carolina Ford, Resource Rural, all the people. I always try to remind myself to give all the shout outs and give the grace and the thanks. I mean, Deborah, I think, hit the nail on the head, all right? We're trying to have thriving communities. We're trying to live the American dream. We're talking about whether we're willing to invest upstream or continue paying more downstream. This isn't theoretical. We know this works. There's data to back it up. And so I would encourage all of our listeners here, the people on this panel, to continue to advocate our General Assembly, to advocate the people in power, the decision makers, and show up and tell them that we need this, we need HOP back in place. In my mind, I always think about this one quote somebody said to me: everybody wants a village, but nobody wants to be a villager. And it kind of feels like General Assembly doesn't want to be a villager right now, none of them. And so I'm cautiously optimistic that we can get this program back in place and support real families here on the ground across our great state of North Carolina.
Now you all know why the people of Fletcher elected Preston Blakey mayor. He's got the truth. Kody, what are your final comments for our audience tonight?
Well, first, thank you so much. It's such an honor to have been alongside all of you for this conversation and to really rest in the expertise that you have of the work that has been going on the ground. And so it's really wonderful to see the impact of this program, even in this moment of pause. I really have two things to leave folks with. This idea of healthcare costs and affordability has captured the imagination of the public. We're all strained and struggling and frustrating. There's not enough money to make ends meet, especially when so much money goes towards healthcare. The best way that we can prevent spending money on healthcare is by helping support people to be healthy. This is an amazing program that drives down the cost of healthcare. It works. It's the most impactful thing that we could do would be giving people these basic, incredibly low cost tools. Healthy food is much cheaper than just one stay at the emergency department or the hospital. And so getting this program back in place is the most important thing our state can do to try to control healthcare costs. And the second thing I would say is that this is not a safe, as you've heard from Preston, and you heard from Deborah, this is not a safety net, this is a springboard. This program launches individuals and families into that dream, into that future, into that excitement over and over again. It is the engine for the economy in so many ways, and we don't need to walk away from this program. We need to learn from it, and we need to make it better. And I know that the people of North Carolina can do that.
Well, thank you for your leadership, Secretary Kinsley, and for continuing to stay involved in advocacy and supporting us tonight in trying to keep HOP alive. I like the way you said it. It's a pause. And I saw in the comments a number of folks who were saying they're starting to lose hope, but maybe have some continued hope because we're still out here. There's a ton of people on here tonight, 76 people right now who are all still concerned about this and trying to advocate for it. And we just need to activate more people around the state. Thanks to everyone who tuned in. I'm Graig Meyer with the North Carolina Justice Center, and I'm so glad to be with our panelists tonight. Proud to have this event hosted by Beacon Media, by Carolina Forward, and by Resource Rural. Stay tuned for more information on how you can be involved in advocating for HOP and finding other ways to be engaged for a positive North Carolina. We have so much work to do, and there's so many great people here. We can all carry it forward. Thanks to everyone for joining in, and I hope you all have a great night.